Hello, everyone. Welcome back to week 15. I hope you had a great break and you're ready to wrap things up. This is the last lecture I'll give. We're going to talk about health disparities, which is actually kind of what a lot of us do at UAB in the sociology department. So, I'm going to give you some insights into a lot of the research that's actually conducted in the sociology department here. It's surprising not a lot of students actually see the studies we do, which a lot of the professors in sociology are doing some really interesting thing. And I'll even talk a little bit about my own research at the end. But let's get into it. We have for this week a few readings. I won't say much about that. Just do them at your own pace. You should hopefully get done with those, though, before the end of the week. You'll have your final exam. Oh, and before I say anything else about this, let me take note that if you didn't see in the pages, the front page of the website on Canvas, that you are only going to have 2 grades counted on your exams. So I'm going to drop your worst exam grade. So if you've done really poorly on one of the exams, don't worry. I'm going to drop that bad grade. So if you're doing great and you've made A's on all your exams and you're set, you don't have to have this final exam. If you haven't done great on one of the exams, you can use this final exam to replace the bad grade. So just a reminder, and that should help out everyone's grade. And if you've been working hard, it should give you a little reward. You could take some time off. So, what is medical sociology? And this is what we do at UAB. Our department offers a PhD in medical sociology, and it's the sociological study of health and related topics. Medical training is involved in how society influences how we train doctors. The stress process is all about all of the experiences that expose us to stressors. Is just something that elicits a stress response, and that's connected to a whole cascading chemical process in our bodies that can damage our mental and physical health over time. Health disparities, these are what we're going to talk a lot about today. But and in general, it's the idea that you have some kind of social group, and that one social group generally has better health than another group for social reasons. That there's something going on, that there's maybe an inequality of health insurance or health care. There's an inequality of exposure to stress. There are lots of explanations and lots of research in this area. And it's overall the study of health and society, very simply put. Now, where did this study of health and society start? With a guy named John Snow, which you may be thinking of this John Snow, but that is not the John Snow we're going to be talking about. We're going to be talking about this guy here. He lived from 1813 to 1858. He was an English physician. He was considered he still is considered the father of modern epidemiology, but he also has a place in medical sociology as well, because he was able to figure out what was going on in this area of Soho, London in 1854. There was an outbreak of disease, and he went and tried to meet people and figure out, how do we deal with this disease? And he went to a map and he mapped out where the disease was happening, and he realized there were some patterns going on. He was seeing these outbreaks near certain water systems. They were getting water from the same place, and they fundamentally changed how we do waste systems in London and waste systems around the world. So what ultimately he figured out was they were dumping things into the water that were making people sick, and that we had to keep our water clean that we were drinking. So that led to a lot of future research that was interested in how we organized ourselves and how that organized social life influences our health. And some of the foundational works for sociology is this Ferris and Dunham study in 1939, and it's called Mental Disorders in Urban Areas, an ecological study of schizophrenia and other psychoses. It was a study of mental health problems in Chicago. And it was the first real systematic analysis of actual data, this relationship they were looking at between social and economic and housing conditions, and then seeing how that related to psychosis. There were lots of methodological problems in this research, and it was followed up after they found, though, that the researchers were able to see that the homes of patients were able to locally, they generally came from these like outskirts of the city, and they generally moved inward to the center, and it reflected other rates of distributions like in unemployment, poverty. And so it was basically showing that some of the mental health problems, they were occurring at higher rates, where you also see higher rates of things like unemployment and poverty, right? Like I said, methodological problems. Hollingshead and Reddick came. This was a study of New Haven, Connecticut. They used education and occupation. They created different social classes. Now, a lot of the things they did, even like for 1958, they were really new and interesting. Maybe in sociology, we wouldn't measure things like this. So again, possible that there's some methods problem. Well, there were lots of methods problems, but their results really showed high disproportions of schizophrenia among the lowest social groups. And they also found that the lower people were on the scale of social class, the likelier they were to be admitted to hospital site for psychosis. So contemporary views looking at these health disparities, they tend to use the idea of fundamental causes. And it's a extension of what we've seen in prior research and those relationships, but trying to explain why we see this relationship between poor socioeconomic status outcomes and also poor health outcomes. And fundamental causes of health says that social structures with several of these, basically, if you have a social structure with several features, then you're going to get something that basically will always shape health of the population. So let me go through these. If you have some social structure that's related to multiple health outcomes, so think, oh gosh, education is related to obesity, it's related to cigarette smoking, it's related to heart disease, it's related to cholesterol, it's related to all these various health outcomes. You could think about a relationship of some social structure to health that it remains the same over time as well. So you may think of income. So over time, the income shapes health, and it may shape health through a variety of reasons, but there's always this association between health and income. Flexible resource is the final thing that defines a social structure as a fundamental cause. What this means is that you have something that allows you to use a resource to your advantage whenever you need it. So think income, it's very flexible. Do you need income for improving your diet, buying a gym membership? Do you need income to help you get therapy to quit smoking? You need income to, a lot of times it helps you buy private insurance if you have income. Also, if you do encounter some kind of terrible disease, it's way easier to treat if you have the income to do that. So again, that's a flexible resource that some social structure can provide you. Socioeconomic attainments are really thought of currently in socioeconomic literature, in the scholarship on health disparities. People really talk about whether you have some kind of economic, educational, or occupational achievement. So, what's the difference, right? When you think economic, think about a family's income, but also think about the wealth that they have. What's wealth? We've talked about a lot about this in this class. It's the things like, what's their house worth? Do they have cars? Do they have savings accounts? Do they have stocks? Do they have all these other things other than income? There's also educational attainment, the occupational prestige that you have. Think prestige as in, is it something that really elicits power and interaction? Is it, a professor versus the CEO of a big company versus someone who works at a car shop versus someone who cleans houses? Those are all occupations of varying degrees of prestige. Also, occupations come with different perks. So we look at these as representations of socioeconomic attainment, right? Remember, we've talked a bit about this, and we also link this in medical sociology to different health outcomes. So you can look here, these are, um, this is a graph looking at the percentages of heart disease and hypertension by income. So you could look at the differences of green stroke, blue heart disease, purple is hypertension. And you can see that as you go down and on the x-axis, you're starting with high income, and then you're going down from 100,000 or more to less than 35,000. That the percentages for all of those are substantially higher. Now, the very last three bars, that's the overall average of all adults. So you can see that at the first 100,000 or more, that's actually lower than those averages, right? So there seems to be an improvement among those. Now, you could look at remaining years of life for US adults at age 25 by educational attainment, looking at less than high school graduates, some college, college graduate, and graduate degree split by gender. You can see there's a little bit of a difference between genders, but the differences are most pronounced at less than high school, right? So the higher the educational attainment, the higher the remaining years of life is, and the less unequal men and women are. Here's an example looking at the survival rates over time of Americans aged 51 to 61 in 1992 by wealth quintiles. So we've looked at income, we've looked at education. Here's just showing wealth in, this is, when I say wealth quintiles, this is net worth. So someone has gotten information on these respondents, on their assets, like all the wealth they have in their house, their cars, and then they subtract their debt. So it's the total net worth. And you can see that the survival rate, you're surviving at much higher rate in the richest 20%, and that slope downward for the poorest 20%. See how quick it goes downwards? That means as they went from 2000 to 2014, they were had much higher mortality risk. Now I'm going to tell you a little bit about my research. Just I thought it might be interesting. These are some papers that I've had come out. This has actually been a couple years at this point, but still for sociology, this is fairly recent, and they're all about multi-generational attainment. That's socioeconomic attainment and mortality risk, and trying to think through how our families and our family's attainment are related to our own survival in the population. So I needed to start out with a theoretical framework, and I started thinking about background to foreground, the long view of inequality that Robert Mayer advocates for. This is the idea that families transfer various advantages or disadvantages across generations, and that attainment, and again, when I say attainment, I'm really talking about socioeconomic attainment, that we're thinking about things like education, occupation, wealth. This is really a multi-generational process. And the standard model of attainment, we have this idea that our grandparents attain a certain amount, they're able to give our parents a boost, our parents give us a boost, right? This is assuming we're in the third generation of a family. This is pretty standard model of attainment we've actually talked about, I think, in another class. And one of the arguments of stratification research is that there is a connection from this first generation that goes all the way to that third generation. That's sometimes hard to see, but there's a lot of evidence suggesting that there's something unobserved about family attainment. There's a social connection that goes beyond biology. And you get families that are dynasties or influence each other's attainment over time. But we wanted to look at mortality in later adulthood. So we wanted to take the idea of having these multiple three generations, but we wanted to think about how would that influence this in the middle, looking at how personal entertainment in the second generation influences their mortality, how their parents' attainment influences their mortality, and how their adult children's attainment influences their mortality. So we're focusing in on this generation two. So if I'm in this study, right, for me, you'd be looking at my personal attainment, how that predicts my personal mortality, but you'd also want information about my parents and how well my adult children are doing. So remember, we're looking at older adults. We're wondering about their mortality of older adults in later adulthood. So we're thinking about who became a parent and how successful in respect to socioeconomic attainment were their children in addition to their parents. So this idea, we're calling these idea the adjacent generations. That just means the generations that are kind of side by side, that were sandwiched in between. And there's reason to believe this theoretical framework, not just because it kind of hopefully makes basic logical sense, thinking about your own examples of getting things, whether it's, socioeconomic advantages from both parents and adult children, but there are these lines of research within sociology. One is called the long arm. This is the idea that what we experience as children when we are living in our parents' household, they have long-term implications for our health. And there's a whole body of research out there that shows that your social class, kind of where you came from, is influenced with your survival, basically, and health at various points in adulthood. So there's research that provides evidence of that. There's also a lot of work looking at personal attainment and how what you've achieved on your own and the income that you have in adulthood and the wealth that you attain for yourself, that is also strongly related to how long you live, how healthy you are in middle adulthood as well. And then there's this other body of research called the social foreground perspective. And this is a body of research that's shown that your children, by way of attaining, are able to basically return in later life all the advantages you gave them. So if you are struggling, you're having a problem, your kids can come back if they're wealthier and offer you financial assistance. If they're more highly educated, they may offer you lifestyle assistance, helping you quit smoking or get a healthier diet or get to the doctor and navigate the healthcare system. So there are all these different pathways. Now, what we did in our research is we took these three different areas of medical sociology research. These weren't really talking to each other, but we saw this as one big process, right? There was an area of research looking at the social foreground, but they really weren't paying attention to parents. There were researchers looking at parents, but not thinking about their adult children, right? So we are the first that pulled it all together. And that allowed us to do a couple studies, one in demographic research, and we used data with older men. And I won't go too much into detail here. This is not going to be on your exam. Understand multi-generational attainments and how that's what that means, but you don't necessarily need to know about the data for these studies. This is just for those of you who are interested. You can kind of look through this and see that we looked at both men and women. They were older. They all were born early 20th century. And so we had to consider historical context when we were thinking about what is attainment for these people. What is their socioeconomic attainment? How do we measure it? So their parents were being born in the late 1800s to the early 1900s, which was really before schools were that common, or I should say public schools. And then the children of these samples were born in the mid-20th, when education was really critical to getting an occupation and being successful in any kind of business. So during the lifetimes of these three generations, we saw this huge changing occupational structure in the 20th century. the expansion of education, where it became critical for occupational attainment. We also saw an expansion of civil rights, where African Americans who weren't given many opportunities to enter into the labor force at the same rate or at the same levels of prestige as white Americans, that there were some real changes going on in the US. So we had to account for all of these historical, contextual issues related to socioeconomic attainment, while also thinking about, you know, what is it we're trying to look at with respect to, like, what data do we have available? So sometimes we struggled with getting enough information about attainment, but I think overall we were able to get um, a lot of good information about what should count for these different generations. So we thought that we were probably going to see occupation matter more for the parents because education is not around as often. Wealth will really be the critical factor for personal attainment. And then education is really going to be the most key issue for adult children. So we looked at the NLS men with children, as I mentioned earlier, and this is just, just a visual image on kind of what matters for them. We did find that parents' occupation really was key. Children's education was also important, as well as personal wealth. When we looked at women, there is some variation across white and black women, which was pretty interesting. And we looked at, these are just baseline survival curves. Again, this won't be on your exam. This is just if you're interested in this. If not, you could probably fast forward real quickly. It won't kill you. So this is just looking at the white sample versus a black sample. And then if you look down the first column for white women, we're looking at parent attainment, and then in the second panel, personal and spousal attainment. Third panel, adult children's attainment. This is years of schooling. And for the black women on, that's going to be in the second column. The first panel, parent, again, personal and adult child. What's really interesting is you see that the curves look almost identical when you get to adult child's attainment. So this is basically the adult children of these black women are getting basically the same resources from education as the white children sample. So you're seeing their process kind of looking more like after the civil rights movement, basically, is the argument in the paper. If you're really interested in this, I'm happy to share the PDF of this paper, and you can really dig into what we're talking about here. It takes some detailed explanation, but for those of you who are curious, I could pass that along. And so overall, from all the research we've done, we've learned that there is evidence of a 3-generation model of mortality that we described. And we've also found that there is really critical that you think of the historical context of an individual when you're thinking through what is socioeconomic attainment for them. That is it. I hope you had a great semester. I'm sure it has been wild for many of you. These are wild times we're living in, and I hope you've been able to wrap things up well. If you have any questions, you'd like to talk to me about anything, or the final, let me know. Your review for the exam is posted. And I hope everybody, if I don't talk to anyone after this, have a fantastic break.